So for more on this, we're joined now by Dr. Dina Kulik, who is a pediatric emergency medicine physician, and she's joining us from Toronto. Dr. Kulik, thank you so much for making time for us.
No problem.
Let's begin with your reaction to this government decision.
I think a lot of families are very happy. They're very eager to get their children vaccinated and feel a little bit more comfortable living their lives as many adults have since they've been vaccinated, going back to a more normal way of life and having comfort in doing so.
Now, that may be what most people feel, but of course there is a contingency, and there's quite a few parents who are concerned about giving this vaccine to their children. For all the reasons that adults are hesitant, people are particularly hesitant for their children. How do you respond?
I think a lot of it comes down to education, right? So a lot of families are not sure why we would be vaccinating our kids when many families tell me, you know, kids don't get very sick with COVID and the numbers are relatively low right now. And so a lot of it is really providing education, showing them that the vaccine is safe, that it's effective, that the side effects are quite minimal or not even present at all for kids. And again, it can lead us towards more of a normal way of life as we raise the percentage of people vaccinated so we can achieve that herd immunity that we've been speaking about for so long.
Many people have brought up the argument that COVID-19 hasn't impacted young people in the same way that it impacts older people. So is this even necessary?
Yeah, so it's an interesting argument. While it is true that most kids that get COVID don't get very sick from COVID, and few children have died from it, it absolutely has impacted their lives. You know, schools were closed for a year. The emotional and physical problems associated with COVID-19 are quite significant, and many families still feel uncomfortable with their kids participating in normal activities. So some kids are still at home more often. Some kids are still virtual learning and not yet in the classroom. And if we want to head back towards that more normal way of life and have kids, you know, playing with their peers and going to extracurriculars and having more confidence in doing so, that will help to get them vaccinated.
For those parents, and you've given us a number of tips already within this conversation, but if you had to speak to a parent who came to you for your guidance and said, I have some real concerns. We've only been living with this thing, even though it feels on the one hand like a long time, it's only been a couple of years. The vaccine's only been around 1 year. Okaying it for kids has been around for a day. And now here we are. We're about to inject these medicines into our children when maybe they don't need them. What would be your response, particularly when people are concerned about the reactions, adverse side effects?
Right. Well, when I have these conversations with parents at my clinic called Kid Crew in Toronto, we have these conversations and I want to know from families, what are their concerns? What do they know? What have they learned? What have they heard? Oftentimes through media and social media. And what are they concerned about? Are they concerned about side effects? And then I review the side effects, mostly being the same as what adults experience. So, you know, red or sore shoulder, achiness, fatigue, the risk of myocarditis and pericarditis that a lot of families are concerned about is very, very low. And, you know, in the States, they've given a few million vaccines to kids already, and the rates still have remained very, very low. And the vaccine really is showing to be very safe and effective, both in the real world in the States where they've given these millions of vaccines to kids, and also many, many more million to adults and teenagers. It's safe. It's effective, and it's not causing the same side effects as a lot of parents worry about.
Dr. Kulik, what would you say to the concern that while it's nice that we're now able to vaccinate children who are very young, the vast majority of this planet hasn't even received its first dose yet? So shouldn't the bulk of the global efforts now be to vaccinating older people, people who are immunocompromised, those with any kind of health conditions in other parts of the world, rather than concentrating on children who haven't really demonstrated that they get very sick with COVID?
I think we should be doing both, right? There's lots of vaccine around the world now to give out to everybody. Almost 45% of the world has received at least one vaccine, right? We're at almost 50% double vaccinated of the world's population. So it isn't like it was when we were first getting our second doses, for example, and people were saying, yeah, but only 10% of the world has been vaccinated. Now we've come so far There's an abundance of good mRNA vaccines now around the world. And so I think we could and should do both of those things, protect the young people and protect the world's population. And of course, some kids are at risk. Some kids are immunocompromised, and some kids live with parents, family members that are at risk. Protecting our kids does more than just protect them as individuals, but helps protect their families, their loved ones, and their community at large.
Okay, Dr. Kulik, thank you so much for your time.
You're very welcome.
Dr. Dina Kulik is a pediatric emergency medicine physician, and you're watching CBC News Network.